overall 85% improvement just after 6 days. Dizziness, neck pain, shoulder pain, jaw pain, ear pain. I had eye pressure, headache, acid reflux. I was dealing with atrial fibrillation with my heart. I had a heart ablation. I can't even begin to put into words how thankful I am for Dr. Raman and his team here. My name is Ryan Vaughn. I'm 45 years old, and the main symptom that brought me here was jaw pain initially. So it was just getting to a point with my jaw pain where it was radiating through my ears, my neck, my head. I just was at a point where I just could not function, and the dizziness, it all just kind of snowballed. And so that's when I reached out to Dr. Raman. So the jaw pain started probably around April of 2025. It started, I would probably say, somewhat mild, but within a few months, it just progressively got worse. And I would say today, at this point, I would say rate the level at about an 8 or a 9. It usually gets a lot worse. You know, it's usually right at the top of my ears, right here, side of the pain. This part right here is probably the worst on both sides. It's equally, you know, intense. And like I said, I'd probably put it at an 8 right now. And then it usually gets a little bit worse if I put any kind of pressure on it, like sleeping on my side, on the side sleeper. So that usually makes it a little bit worse. So I went to a dentist, found out I had a wisdom tooth, one that was sideways. He recommended that I maybe get that pulled, although when I was right at the very moment when I was in the chair getting ready for it to get pulled, the dentist or the oral surgeon that saw me said, you know, I just really don't think that this is gonna fix your symptoms. So at that point he said, I really think you're struggling with some jaw issues, some TMJ. And so that's when I reached out to Dr. Raman and said, hey, I need your help.
Okay.
So if I'm just at a resting state, you know, I would probably put the jaw pain at about 5 or 6. But if I open my mouth, you know, to like that, it'll go up to about an 8 or a 9. If I'm chewing, like soft foods, it's probably stays at like a 5. But if I'm chewing anything like hard, you know, it usually goes back up to about an 8. The main symptom that has really affected my life, my everyday life more than anything, is the dizziness and just kind of unbalanced feeling. Eyes have a hard time focusing and some brain fog in there. All of that together makes each day pretty difficult. And so that's the number one symptom that I'm really excited to fix and eliminate. It started back in September of 2024 when we were descending from a flight from Alaska. You know, normally your ears will pop on the airplane when you're descending. This time my ears didn't pop, and didn't pop for a long time. And so from that point forward, you know, I just started experiencing the dizziness, the floatiness, all that kind of stuff. And so I went and I've seen so many different specialists for it. Obviously went to my primary care doctor first. He recommended at that point to see an ENT. They looked at my ears. The ears were completely fine. I walked away from that appointment probably more discouraged than encouraged, because I'm like, I just really wanted to pinpoint the issue and get it fixed. And so ears were fine. Beyond that, went to an acupuncture, did that. I've been at chiropractor, still in chiropractic care twice a week. I've tried prolotherapy. I've tried deep tissue massages. I've tried, obviously the dentist that I went to recommended a night guard. Tried that, and that actually made it worse. It seems like I was clenching a little bit more whenever I was putting that in. And so I've just spent so much money and different specialists, and I just have not, I feel like they haven't gotten to the root cause. Another one that I tried was, I went to an optometrist, and because I kept hearing this term BVD, Binocular Vision Dysfunction, where your eyes are misaligned a little bit. And so spent quite a bit of money on prism lenses and wore those for about a week, and just, it did not work. And so again, left feeling very discouraged, and it seems like I was just throwing money after, you know, a lot of money at all the symptoms and these specialists, and I was just walking away feeling discouraged. So, So I wouldn't describe the dizziness as room spinning dizziness, like a vertigo necessarily. It's just very unbalanced floatiness. And like I said, just my eyes having a hard time focus. And I would put that at about a 9 or a 10, honestly. And I live with that every day. I think I've gotten to a point where I've just told myself every day when I wake up that I'm going to experience that. So I just learn to live with it and learn to manage it. but it's not fun. Yeah, so my wife and I own a commercial cleaning company. And so as the owner right now, we've been in business for 15 years. And so I spend a lot of time driving. I drive all across the metro, checking on clients, staff and things like that. And so the dizziness and unbalanced, it does make me a little bit nervous when I'm driving. And so I don't necessarily, although sometimes I'll get in and do some cleaning and whatnot. So if I'm up and down, sometimes it affects that. But most of the time the driving is, because it's just your eyes are trying to focus, and it just makes it really hard to do that.
Okay.
So my ear pain, it's one of those things where I guess it would feel like it mimics an ear infection or fluid in your ears. But again, when I went to the ENTs, ears look great. There's no fluid, none of that. She even said, we can put you on an antibiotic and a steroid just to see, and they did. The steroid was kind of nice, but the effects of that wore off quickly. And so I'd probably put the ear pain, pressure, all of that at an 8, 7 or 8. It's usually on both sides. Sometimes, the right side is a little bit worse. I do sleep on my right side a lot, so I'm not sure if that has an impact on that. But yeah, the ear pain and pressure, it's definitely something that I live with every day at 6 or 7, each day. Yeah, so the ear pain probably started around May, June, July, somewhere around there last year in 2025. I would say it started probably at a 3 or 4. It was more discomfort than anything. And then it progressively got worse over the next probably 6 or 7 months to where I'm at now, which is, like I said, about a 7 or an 8. And it just seems like it's all interconnected right in there, that ear pain and pressure. It's just, it's tough, is neck pain. And that one actually started, that was probably the initial symptom that started in 2024 on that flight from Alaska as we were descending. When I got off that plane, the neck, it just tight, stiff all the way. It starts kind of up here on the high neck area and just radiates down into my trap area. And so if I was to push on each side is usually about equally the same in terms of pain. As I push down, it's painful, and then it radiates up through my neck. And so the neck pain is definitely a 10. I live with that each day. I'm constantly doing this. If I'm sitting in church, people probably looking at me like, what is that guy doing? And it's really, honestly, I do this just so that I can stay focused, because the neck, it's tough. The neck pain is really tough. And I do go to a chiropractor, like I said, twice a week to get adjustments. And although that helps, it lasts for maybe 24 hours. And then when I wake up the next day, the neck pain is right back. The neck pain, the lowest it'll go, and this is really on the heels of me putting ice on it. It seems like ice works really well. After chiropractor, I would probably say it goes down to about a 5, maybe a 4 or 5. And then, like I said, within 24 hours, it's right back up to a 10. Yeah, it's usually equal on both sides. Like I said, sometimes the right side's a little bit worse just because I sleep on my right side. But most of the time it's both sides. I am right-handed. I feel like the eye pressure is tough. If I had to rate that, I'd probably put it at about a 7 or an 8, I would say, in the eye pressure.
When did that start, and where all does it treat?
Yeah, the eye pressure started pretty much right around that time too, after the flight, shortly after. And I think, again, just with the neck pain and the jaw or whatever, is just causing a lot of pressure behind my eyes. Which then it just transpires into a headache, and the headache is usually right in here. And so again, the thing that brings the most relief for the eye pressure is just ice. Seems like if there's inflammation in there, it certainly helps. And then I also, with that eye pressure, simultaneously I'll have pain right here in the base of my head, and that's pretty significant too. So anytime there's eye pressure and pain, that spot back there is equally hurting at about an 8 or 9. Yeah, I'm not sure if it's related, but a lot of times my back, so like the neck pain, a lot of times will go ahead and transpire down to middle of my back, shoulder blades, upper back. So anytime I go to the chiropractor, that's an adjustment that always gets done and feels a lot better afterwards. But I would probably say back too. Upper back is every day. I'd probably say it's about a 7 when I wake up. If it's a chiropractic day, it goes down to about a 3 2 or 3, so it does help a lot. And it seems like after I get a back adjustment, that relief lasts a little bit longer than like the neck. So my back will probably feel good for about 2 days.
Is that comfortable?
That's
right
good.
there? And I'm going to check your balance now. This is your how you live. Teeth are together, bite down, arms all the way out, a little bit higher. I'm going to push down. You look pretty strong, but I'm going to try to push down. Don't let me. Be like a statue. Bite down tight, bite down tight, bite down tight. He is strong. Bite down tight. One more time. Okay, that's your baseline. Now lean against this wall.
Right.
Yeah, back against the wall. Have your feet the same width as before, but I've just given you as support. So everything below the shoulder has been supported. If you have a scoliosis, hip problem, knee problem, whatever, temporarily got some help. See if it makes a difference. A little bit higher. Bite down tight, bite down tight. One more time. Not much of a difference, none at all. Now, let's do this. Come back here one more time. Okay, have your feet the same as before.
Yes, sir.
Okay, no, don't change anything. I'm going to just put this in your mouth. Just a second, just a second. Now bring your teeth into the indentations. There, arms all the way out. In a second, I'm going to check your balance. Then don't move your feet. Then I'm going to take it out and see if there's a difference. Bite down, relax you a little bit. The teeth are together. One more time, one more time. I can't bring it down. I'm going to use my weight. 182 pounds. No deal. Stay put. I'm going to move this one. Don't move anything else. Arms all the way out. I'm going to use the same amount I did a second ago. Bite down tight. Bite down tight. I'm not even sure I need to do all that.
That's crazy.
Oh, at least 10.
You okay?
Huh?
You okay?
I'm good. It's my workout for the day. Yeah, much easier to bring it down. Bite down tight. So what's your body doing all day long? Has to compensate for this, right?
Yeah, it does.
They'll wear you out. That can be a source of fatigue, and also a body that's constantly fighting is in a fight or flight mode, not rest and relax mode.
I mean, I can't even put into words how much better I'm feeling just after 6 days. I gave an overall 85% improvement. You know, I had a list of 6-7 symptoms that were pretty severe when I came in, and each and every one of them are well over 60% improvement, most in which are in the 80 and 90% improvement, like I said, after 6 days. So I could not be happier. Yeah, the symptom that affected me the most was the dizziness, kind of unbalanced floatiness. And I had told Dr. Raman, I said, if you can just fix that one symptom for me, I'll deal with everything else for the rest of my life. But little did I know that I got that one fixed and mostly all the rest of them. Yeah. So I would say the dizziness and floatiness and unbalance, 99% after 6 days. So I think the second one after that was the ear pain, ear fullness, pressure. And I would say that one is 90%, 85, 90% better. I mean, I had been to a specialist for ear infections, obviously chiropractor twice a day, deep tissue massages, prolotherapy, the list goes on, and I just wasn't seeing any permanent relief. Maybe a day, but then it would come right back. So I knew we weren't getting to the source of the problem. I mean, it's gone. Yeah, I don't have any ear pain or pressure. Even when I sleep on my side, I noticed when I slept on my side, obviously putting pressure on your jaw and your ear, that would hurt really bad. And within the last 6 days, after sleeping on my side, I have none. So yeah, it's been good. Eye pressure. So eye pressure was tough because when I came in, that was pretty severe. Double vision, brain fog, hard to focus. But after 6 days, that eye pressure is 90% better, if not 95. I mean, it's significantly improved. So yesterday at church service, which was amazing, Easter service, you know, I used to look up at the big screens and there was like kind of double vision and blurry. Each letter of the words was blurry. And within like looking at it for a second or two, I would have to blink and kind of look away and then refocus and do that all the time. Sunday morning, didn't have to do it at all. So I was really excited to be able to just like stare at the screen and read the words and all that kind of stuff without having to adjust my eyes. So jaw pain is 100% improved. And I will tell you, within the first 24 hours of getting my orthotic device put on, that jaw pain almost immediately subsided. That was the one that I noticed that just improved right away, which was great. And so, yeah, it went away. And again, that helped significantly with sleeping at night because I wasn't getting good sleep for many reasons, and that was just one of them. And so to be able to lay my head down, because I'm a side sleeper, to be able to lay my head down on my pillow and not have any pain or pressure, it just helped me fall asleep much faster. Jaw pain's 100% improved. So I could tell right away that I knew before I wasn't getting good quality sleep because of how I felt when I woke up. I woke up and I would probably take 45 minutes at least to get like the energy going and my day going. It just took a little while to get charged for the day. And then by noon or 1 o'clock, I was tired and had to lay down. After treatment, I can get up. I'm getting up in the morning like right away and I'm feeling like my tank is pretty full. So I get to go right about my day. And the good news is that energy, it lasts pretty much throughout the entire day. Which, what does that mean? That means I don't have to take a nap at like 1 o'clock as a 45-year-old man with 3 boys and a wife that needs me. So it's just been great because I just, that energy is sustained throughout the day. So I've been enjoying that for sure. And so my newest symptom, which is very severe, it's excessive. I noticed it probably on day 2 or 3, is I have this like excessive joy and gratitude. I always think that somebody's spirit is important. I think it's like an equilateral triangle. The body, mind, and spirit need to all be equal and balanced out. And I will tell you, the level of joy and gratitude that I have experienced this last week since my procedure has just been off the charts. And my wife notices it, my boys notice it, people at church were like, noticing it. And so I'm just really, really excited. Yeah, I mean, I was trying during the consultation to get it out of Dr. Raman, like, tell me how I'm gonna feel afterwards, you know, what this, that, and the other. And he just kept saying, well, I don't, you know, I just want you to tell me where you wanna be and all that kind of stuff. Because obviously nobody knows truly what you're gonna feel like afterwards. But I had high expectations. I've spent thousands and thousands of dollars over the last 2 years trying to correct this problem. And I was not addressing the source. And so I'm gonna be honest, I was a little skeptical in the beginning, just because of my past and what I've been through, you know, with this issue. And so, but I could tell there was something different during my consultation with Dr. Raman. Just his intentionality and his drive to really get to the root of the problem. I mean, even the consultation itself was very, very extensive. Just the questions he's asking, the scans that he's taking, just the intricate detail they took to look at movement and jaw placement and everything. And I think I had more scans in 24 hours than I did my entire life combined. And so I knew after that point that I was in the right place. I was like, I had hope and confidence that Dr. Raman was gonna fix the root of the problem. And after 6 days, I'm a believer. Yeah, I mean, I'll tell you, within 5 weeks, my life has changed dramatically for the better. Initially was the jaw pain, and the jaw pain was pretty significant. And so within 5 weeks, I go from probably a 4 out of 10 to a 10 out of 10, meaning I've had 100% improvement in 5 weeks with the jaw pain. So very excited about that. So I noticed an improvement of probably 80%, believe it or not, within that first week of having the orthotic on. Which was exciting. And I'll even say within 24 hours of having the orthotic put on, I noticed a significant improvement in the jaw pain. So although the jaw and neck pain, or the jaw pain was initially the reason for coming in and making the appointment, the one symptom that I told Dr. Raman, I said, man, if you can fix this and eliminate this particular symptom, I'll be happy. And that was dizziness and unbalance. So I could deal with the neck pain, the shoulder pain for the rest of my life if I had to, but this dizziness, it just affected every area of my life. So yeah, and after having the orthotic on for 5 weeks, that symptom as well is 100% better. Yeah, so the double vision, eye pressure, eye pain, things like that, that was a pretty significant symptom as well. Headaches, I think it was maybe all tied together, but even sitting in church, you know, we sit on typically the back row or back towards the back, and the words up on the screen were just blurry, again, double vision. And so since having the orthotic on, the eye pressure, the eye pain, the headaches, and certainly the vision, the double vision has been 100% improved. I did, yeah. So I was diagnosed with BVD, Binocular Vision Dysfunction, meaning that there was just an alignment issue with my eyes. And so I tried the prism lenses, spent quite a bit of money on those, and just didn't see an improvement at all. And so once we were able to rule out that, we're on to the next, thing. I tried prolotherapy, to try to help with neck muscles, thinking, well, maybe that's what's causing my eyes. And so, neither one of those worked.
Okay.
Yeah, the next one was neck and shoulders. So just the neck pain was chronic. I mean, that was 100% all the time. Just could not get relief. Tried chiropractic care twice a week, and although that would eliminate the pain for maybe 20, I shouldn't say eliminate, it would help it for 24 hours, it came right back. Same with the the shoulder pain, especially in the trap area. I mean, I just could never get relief, and so that was definitely way up there on my list as far as like symptoms I needed help with. Again, I hate to sound like a broken record. Actually, I don't hate to sound like a broken record. In this situation, I love sounding like a broken record, that my pain is 100% improved, both in my neck and my shoulders, and even just the range of motion in my neck, whether it's a rotation or up and down, it's so much better. Headaches, I would probably have a headache at least once a day. I'd have to go lay down on my ice pack or heating pad to eliminate that. And really, I mean, I was taking ibuprofen every day, which I know isn't good. So since having the orthotic on, I will tell you within 5 weeks of having this on, I've taken ibuprofen maybe 3 times, maybe. And so it's been nice, and I think my kidneys are a lot happier too that I'm not taking ibuprofen like I was. I would say on the neck and shoulders, it's 95%, maybe a little higher. I'd probably say within 3 weeks at the most, 2 to 3 weeks, I started noticing an improvement, and I know I've coupled everything with physical therapy, which has helped significantly as well. And just being religious with that every night, doing the physical therapy exercises, I think that's helped a lot too. So about 3 weeks. I've never done physical therapy in the past, so I really didn't know what to expect. So it's been great. I had ear pressure. So I felt like at the start, what's kind of kicked all this off, or maybe just kind of pushed it over the cliff, was when we were landing. We had a flight coming in, and typically your ears pop. Well, my ears never did pop. And from there, it just kind of like snowballed downhill. And so the ear pressure, I just was walking around feeling like my ears needed popped all the time, and they wouldn't. And because of that, again, the ear pressure caused headaches. The headaches caused double vision. It just kind of was like a domino effect. So since the orthotic, my ear pressure is 100% better. It's completely gone. So usually I wake up at the same time every morning around 6 a.m. And before I got the orthotic on, it would take me 45 minutes to an hour to really get going. Meaning like I did not just open my eyes and spring out of bed. It took me a bit to do that. Since having the orthotic on, I wake up and I'm ready to go. So I'm there. And when we look at quality of sleep, before the orthotic, and I still do, around 8 o'clock, I'll drink a full glass of water. Before the orthotic, I was getting up probably 4 or 5 times through the night to go to the bathroom, meaning I wasn't going into a really super deep sleep. And my body was just, because of that, my body was just constantly telling me, you need to go to the bathroom, you need to go to the bathroom. After 5 weeks of having the orthotic on, I'm sleeping all through the night. Still drink my full glass of water at 8 p.m., but I don't get up. I'm getting deep sleep, and I wake up feeling very rested. When I wake up now, after having the orthotic on, like I said, I just get up out of bed and I'm ready to go. 100% on quality of sleep. I would say, again, kind of with the neck and shoulder, I would say within 3 weeks, I noticed that my sleep was getting a lot better. And with that too, I noticed I wasn't getting tired quickly. Meaning before the orthotic, I would wake up, and once I got going, if I got 4 hours of productivity and energy and everything like that, I was lucky. So around noon or 1 o'clock, I was ready for a nap. I had spent my entire tank of energy, and I'm out of gas, right? But now, since having the orthotic on after 5 weeks, I get up, and it's almost like I'm using that energy much more efficiently. It's spread out across the entire day, and I don't need a nap. I don't feel like a nap. But by the time I get ready for bed, it takes me about 5 minutes maybe to fall asleep, whereas before it would take me 20 to 30 minutes to fall asleep. So yeah, the balance, actually, I kind of put the balance in the same bucket as dizziness, I guess, because I feel like they're maybe twin brothers. But I've noticed a huge difference with balance, and where I noticed that is when I'm doing projects. Before, when I would do projects, like this last weekend, I painted our entire pool deck and didn't have any balance issues. And that's a lot of up and down and different positions. Whereas, you know, before the orthotic, there's no way I could have done that because I wouldn't have had the balance to do it. So I've noticed 100% improvement with balance. And because of that, I'm able to start and finish projects to their completion. And it's just made a world of difference as it relates to my productivity.
Yeah.
Absolutely. Yeah. I mean, I'm able to lift things much heavier, I guess, than what I was before. I will tell you, even when I first started my, right after I got the orthotic on, the balance issues took, you know, a couple weeks, a week or two, to really start noticing improvement. And I'll tell you, when I first started physical therapy, because the balance hadn't quite improved yet, it was a challenge to do some of those physical therapy exercises because of the balance. Like you said, I mean, I couldn't get my balance when I was doing some of those stretches and exercises and things like that. So as the balance improved, my physical therapy improved as well. I was able to do those exercises much easier than what I was before. So Airway, I feel like that's obviously one of the big reasons why I've been able to sleep so much better, is my airways opened up. I'm getting better air. But it also has impacted how I eat and what I eat. So for example, before my orthotic, I love steak, right? Who doesn't? But before the orthotic, I had trouble not necessarily chewing per se, but swallowing just a very normal average piece of meat. Felt like the opening of my throat was closing or whatnot. And after I would get done eating, my heart rate would immediately increase. So I felt like, you know, yeah, my heart was racing. And then I would also get pretty bad acid reflux or GERD, or, you know, and just that constant like burning in my throat, and man, I'm not getting enough air. And since having the orthotic on, I was telling Dr. Raman this last weekend was my birthday, and I got treated to Longhorn Steakhouse, one of my favorite steaks ever. And I was able to really thoroughly enjoy it because I would take a bite, normal bite again, chew it, swallow it, no difficulty whatsoever. And then even better is after I got done eating, there's no heart racing, there's no acid reflux, there's no GERD. I was taking 2 Nexiums every day, one in the morning and one at night, for that GERD and acid reflux for about a year. I was taking Nexium for about a year. And so since having the orthotic on, I don't take it anymore. Yeah, I'll just say too, and I had mentioned this to Dr. Raman. I'm obviously not a medical doctor, but I have struggled with and had atrial fibrillation, AFib, with my heart. In fact, a year ago on Friday, I had a heart ablation, which improved the AFib significantly. It's completely gone. But I just can't help but think and wonder, looking back on my symptoms and things that were going on around the context of when my heart was in AFib, that this could have been tied to that in some way. Meaning, like, again, I know a lot of AFib patients have trouble sleeping. They have sleep apnea. That's one of the first things they test you for when you have AFib. And
Did they test you?
I did a sleep study, and the sleep study didn't necessarily come back failing, if you will. It wasn't perfect, but I honestly don't think they really knew what to look for. You know, nobody would ever think, oh, your jaw is misaligned, or you got TMJ issues or things like that. So my AFib, obviously the ablation has done wonders, but again, I just can't help but wonder if there was some connections with this to that. So just food for thought. The only thing I'll say in closing is, and I'll say it without getting too emotional, is I can't even begin to put into words how thankful I am for Dr. Raman and his team here. I know people say things sometimes, oh, this doctor changed my life, this, that, and the other, and it may be just kind of a flippant comment. But Dr. Raman and his team, they've truly changed my life. It's not just taking the symptoms away and healing the jaw and healing the joint and the physical aspect, but My relationships in my life are so much richer and deeper because I'm present. You know, when you're dealing with these issues, it's kind of all you can think about, and it really takes over. It takes over your spirit, it takes over your mind, and being able to just enjoy my wife, enjoy my 3 boys, enjoy my friendships, all of that has just improved dramatically. So when I say he's given me my life back, that's what I mean by that. It's amazing. So heartfelt thank you to Dr. Raman and his team. And if you're experiencing these symptoms, don't wait a second longer. Don't spend another dollar on throwing your money at symptoms and trying to treat a symptom. I encourage you to come in and really let Dr. Raman treat the root cause. So thank you.